I've got a lovely bunch of grapes. Polycystic liver disease. Let's chat about it. Let's figure out what we need to know about this common disease. What is polycystic liver disease? Well, it's defined as multiple fluid-filled sacs. So those are the cysts, and they're within the liver. That fits that word, polycystic liver disease. And to be called polycystic liver disease, you have to have at least 10 of them. So 10 separate cysts somewhere within the liver gets you diagnosed with polycystic liver disease. Now check out this CT. As the CT scrolls through, you're going to see a bunch of low-level grays. Those are all cysts. And that's one giant cyst that's going by right now. Definitely more than 10 cysts within that liver, polycystic liver disease. Here's another kind of freaky example. So the liver that's in the back that clearly has all the cysts on it, they actually had to pop a big cyst where that arrowhead is. That was one giant cyst. So they had to pop that one to get the liver out, and then you can see how the surface of the liver is just covered with a bunch of other cysts. And what they're going to do for that patient is transplant the healthy liver that you can see in the foreground with the black arrowhead back into the patient. It's like 1/10 of the size of what the original liver was. So who gets polycystic liver disease? It is usually inherited, and it is more common in females, or rather, I guess both males and females have the same chance of getting it because it's inherited, but females tend to have more severe symptoms that go along with it. Their cysts are larger, more symptomatic. Because it's inherited, there's about a 1 in 100,000 chance of developing it. And what you'll also see with polycystic liver disease is that there are other polycystic diseases of the other organs. So polycystic kidney disease is quite often seen along with PLD. So this brings us to one of our key terms, autosomal dominant. Polycystic liver disease is autosomal dominant. So really, what you only need is one parent that is affected with it. And as this picture shows us, if one parent is affected, genes get passed along, the child has a 50% chance of also being affected. So with autosomal dominant, you have a 50% chance of getting the disease if one of your parents has it. Clinically, these patients under the age of 50 are pretty much going to be asymptomatic. They are going to be developing those cysts all along. We may already be able to diagnose them with polycystic liver disease prior to the age of 50, but they're going to be small. They're not really going to be affecting function of the liver. They're just not going to really have any signs of it. Once those cysts become really big and really intrusive, we're going to see hepatomegaly. Those cysts are going to cause some pain because they're so large. They're going to have trouble breathing. And what you'll see, like the reason pregnant people have reflux, the reason that these patients are going to have reflux is because there's so much pressure, so much pushing on that stomach that it just kind of causes the stomach acid to come back up. So they might complain of some gastroesophageal reflux. So now, as far as treatments go, there really isn't a whole lot that you can do for polycystic liver disease. You can't take a pill and magically it's all done. What they can do though is go in and pop or kind of de-roof one of the cysts, especially if you have a very large cyst that is causing you a lot of pain. So here we can see the surgeon opening up the cyst. All that fluid is going to get sucked out today, but what's going to happen then in the future, as that cyst continues producing that serous fluid, it'll just leak into the abdomen, and then the body will absorb it. So let's take a look at what it looks like by ultrasound. So I'm sure you loved my song when I began, but it does. It does look like a bunch of grapes. It's going to be multiple anechoic cysts within the liver. The other thing that you want to check out while you're scanning polycystic liver disease are any of the cysts looking kind of funky. Do they look like they've become hemorrhagic? Do they look infected? We want to make sure that we are finding those and pointing those out to the radiologist as well. All right, that's it for polycystic liver disease. Make sure to comment the way that you would describe polycystic liver disease in ultrasound terms.